Hey guys, today we're going to talk about a case involving trauma and cervical resorption. This is a periapical radiograph of the maxillary central incisor taken soon after the patient fell. And what we see is the intrusion of tooth number 8 as well as the chipped incisal edge of 8. And possibly we've chipped this corner of tooth number 9 as well. Comparing this location of the crown, it should be clear to all of us that this once was located here and then it's been intruded quite a bit into the alveolar process. Additionally, I want you to note overall thickness of the dentin at this stage. So again, this occurred about a year ago from today. Fast forward 7 months, and this is the radiograph we have on the patient. So during that 7-month period, what we see is that tooth number 8 has extruded quite a bit back to where it should be. Again, comparing the location of the incisal edge, we can't clearly visualize number 9, but it's certainly much closer to the position of number 9 where it should be. At the same time, the crown of number 7 has erupted a little bit as well as we expect. Again, the patient was about 7 years of age at the time of trauma and currently is 8. Another thing, however, we note is that during that 7-month period, there has been a significant amount of cervical resorption that occurred at the distal aspect. Additionally, looking at the mesial surface of the root, it's irregular, suggesting that there is resorption at the mesial aspect as well. Furthermore, I want you to see the overall width of the canal space and the thickness of the dentin. Look at number 9. While you may say it's not clear to visualize pulpal space, it looks definitely narrower than what we see on 8. Additionally, the thickness of the dentin, or the root, is definitely thicker. Look at the apical area, wide open foramen. Okay, it failed to close, or it failed to develop the root. Unlike number 9, not affected from trauma, and the periapical region has been formed nicely, and then the canal is almost closed, or the pulpal space is almost closed. Now, almost exactly a year after the trauma, we have the latest periapical radiograph taken. Here. Patient did receive some sort of restoration to repair the chipped incisor, but unfortunately there's decay underneath the margin of the restoration. Since the last radiograph, perhaps the cervical resorption has gotten even bigger, slightly bigger, and now it's even more prominent that the resorption is definitely seen on the mesial side as well. Still, I don't see any evidence of further root development or dentinal development. It's still very narrow, and there's a possibility that not only this dentin is very thin, there's a possibility that perhaps there's a communication or a perforation into the pulpal space. Again, that can only be, I think, at stage verified with cone beam CT, but that I do see a sign of radiolucency that potentially connecting into the pulpal space. Look at this this radiolucent area. Yes, we do have normal anatomy that we have to account for, which is nasopalatal foramen, which is approximately located here. But this radiolucent area, while we see trabecular bone pattern, it's most likely due to the intrusion, and that the bone had to remodel again once this tooth is extruded. Looking at number 7, it certainly does have relatively wide open foramen, and the root is still developing. It's unclear whether it's been affected by the trauma or not until you compare that with the contralateral side, unaffected side, right? and we can see that the root still hasn't formed very much and wide open canal. So most likely comparing the two, it's looks like number 7 is normal. It's going through normal development as of yet. So that's what I wanted to discuss. Trauma can cause, we know that, external resorption at times, but hopefully this is an example to demonstrate that it can cause the cervical resorption. Another lesson that we can take away is if the patient is intruded and you leave it alone and you don't do anything, oftentimes, especially in this case, it does extrude relatively quickly to its normal position. So that's very impressive, right? If you think about it, given how much that was intruded pretty much fully into the alveolar process, but the tooth was able to extrude itself out again. Additionally, when sustained a trauma as such, body can it can be devitalized, the nerve can be devitalized, and it is true that this tooth did not respond to any cold. And with that, it can pretty much stop the progression of the root development. Another clinical piece of information that I can give you is this has a tooth class 1 mobility. So with this mobility, cervical resorption, short root, compromised crown to root ratio, obviously the prognosis of this tooth is not very good. Not to mention there's a large carious lesion which at any moment could be involved with the pulpal space. So great case to discuss. I hope you find this case to be very helpful. And if you like this video, please hit the like button, and I'll see you next time. Thank you.